Yeah, so with herbs, herbal medicine, you start off learning the basics, the ground herbs, and getting to really, I suppose, understand the classes of the herbs themselves and what they do and fit into how medicine and treatment. And then in the later years, you're actually exploring conditions themselves and then how you would actually apply those herbs to those conditions. You also are expected to do clinic training where you're actually seeing clients and I suppose interacting with a client situation, but also basically having to know what you have to treat for that client. So it's quite a broad range of experience from understanding the herbs to then treating people as well. Medical science is very important, particularly with understanding conditions and how to treat them. A lot of it is like precautions and contraindications and things like that. But you have to do the anatomy and physiology, which is really important, understanding the body, but also pathophysiology, which is the diseases themselves, which is symptomatology and pathology. And also you need to understand chemistry and biochemistry, and we guide you through those things, but it's really important because the actual constituents of plants are basically molecules, I suppose lots of different types of molecules grouped together to actually give the characteristics of the herbs and how they affect the body. So you have to have quite a strong understanding how those herbs work on a molecular level as well. And so there's quite a few courses in the beginning of your study that are basically designated to those sorts of things. Probably one of the main things is the nurturing environment here. Like I find nature care is very supportive and very nurturing. When I was a child, I had some cognitive memory loss from meningitis, and so from a learning point of view, sometimes there's a bit of struggle, and particularly when it's in a stressful situation, part of me can shut down a little bit. And what I've found is that nature care is quite accommodating with that sort of, perhaps with problems with learning styles, or perhaps I find particularly looking from a student point of view is older people coming back to study. There's often that difficulty in kind of like, well, how do I do that again? And I find nature care really accommodates for that, and I find that's inspiring. I also find from a teaching perspective, I find those older people can often give me lots of learning as well, and so I learn a lot from my students just as much as I hope they're learning from me.